So if I can ask you to join us, this panel is going to be on the healthcare system, pioneering healthcare solutions, leadership, driving innovation, and care. Is everybody ready? Apostolos, ready? Tim
Ready.
Johnson, Dr. Lisa. Has anybody ever been to a hospital before? Maybe, some of us. I know we had an individual 2 days ago that hurt himself and broke his arm. Well, the challenge for healthcare systems globally is really this concept around patient care or bottom line. It's a business. They need to make money. Well, what happens? Well, isn't the patient, aren't they more important? So we're going to talk today about this problem globally we have within healthcare systems, technology, as well as within us, that we will spend money on things that are candidly shit for our own bodies, as Dr. Lisa will gladly say. But yet we will not spend money to help improve outcomes in our own lives. Before we dive in, I'd like for each of our panelists to give a quick introduction, name, rank, serial number, where you're from, and then we'll jump in.
Hello, Dustin. Thank you so much for the invitation. Actually, my name is Karabinis Apostolos. I'm the CEO and owner of Karabinis Medical in Greece. And you said something about middle-sized companies before, so that's exactly the case. We are market leaders in Greece in medical commodities and diagnostic devices. And the most, I would say, important matter that is parallel with exactly what you were discussing before is our activities in the health services, where there is a big challenge, as you properly said before, Dustin, improvement of life quality or just business. So there is a big need for balance in that area, and we are focusing exactly on that.
So it's interesting, you know, the life expectancy, at least within North America, in the year 1900, I know, Tim, you should know this number. What was life expectancy in the year 1900?
In 1900?
1900. Life expectancy was around 48.
40, yeah, I was going to say 45.
If we think about that, now I'm 41, telling everybody my age, not to all raise your hands, but 48. Today, life expectancy is what? I mean, you're a guy, you know the math in healthcare, Tim. What is life expectancy right now, on average?
72.
72. Think about that.
Depends on where you're standing.
85. Well, you're a good-looking 85-year-old, super smart. So 85. Well, we didn't just do that by, you know, telling our heads we're going to live longer. We had to make certain adjustments. We're going to talk about those adjustments that were made globally. Dr. Lisa, tell us about yourself.
Hi, I'm Dr. Lisa Corsa, owner of Premier Therapy Solutions, located in Boca Raton, Florida. I am a doctor of physiotherapy, and I believe in prevention, right? Prevention, that's what we need to be talking about. Prevention of these issues, right? Let's figure it out before you get it. So we have a lot of these diagnostic tests in the United States, yet we're not using them. Insurance companies are not paying for these diagnostic tests. So I, fix a lot of people with stroke, brain injury, Parkinson's, muscular dystrophy, MS. But we, unfortunately, are in the private sector. How do we make this global, insurance-based, and the governments pay for prevention?
So tell us about yourself as a little bit, Tim, because this jumps right into you.
Yeah, Tim Johnson, CEO of a company called Health in Tech. We're a combination of a lot of things where primarily we're a tech company that has tried to improve the lives of individuals all around the world. A lot of it is just communication. Miscommunication in health is horrible. You find the right doctor at the right time, you can get a fix. You could spend years seeing doctors, seeing people that don't quite understand your problem, and it never goes away. So primarily that's what I want to do for a company.
So innovation, it's really where it starts. Because if nothing will change, nothing will change. We don't go from 48 to 75 by keeping things the same. We do it by taking risk, calculated risks. Yet we're met with resistance, are we not? Apostolos, talking about the medical device world, what are you working on right now?
Actually, I will agree not only innovation, but on disruptiveness. And diagnostic devices is something common. Diagnostic devices exist for many, many years, as well as diagnostic tests. And it's good to find the cause, find the problem. The point is how to prevent it from evolving badly, and how to prevent it, as Lisa said very correctly before. So in that aspect, many guidelines, scientific guidelines exist today. For example, for cardiovascular disease that we have a huge expertise on, the guidelines are recommending team care approach in disease management, which means that the physician itself cannot handle the patient because he has no time. He just wants to have a trained individual, get the right data, prescribe the right medication, and lead him to control. But this is a big challenge because a trained individual needs to have interventions, needs to make interventions in his lifestyle, and he doesn't know how to do them. So we have created a health service which is called Hypertension Diabetes Corner. It's called HD Corner, and it's global. We launched it in Greece recently, and it's going to be a pilot project for 1 year, which will run directly on the patients. It's completely patient-centric, and we have allocated clinical coaches, which are the pharmacists. So they are taking charge of training the individuals, prepare them in data management, medication compliance, lifestyle adjustments, exercise and nutrition, and we provide all that through scientific protocols and through a state-of-the-art application using AI and machine learning. But all scientific, based on scientific guidelines strictly. And this is why we have an R&D department that all the key opinion leaders are involved, and they are vouching for the scientific nature of the program. So it's challenging.
Are these wearables?
Excuse me?
Are these wearables?
The diagnostic devices.
Yeah.
We use all the wearables and all the diagnostic devices in the world. Yep. The health service needs to be gray. We cannot, how can I say, collaborate only with one device. Right. Then we make it restricted, you understand? Mm-hmm. So the service is the application that has all the scientific protocols, and it communicates with all the devices around the globe. And we provide exercise schemes, nutrition schemes, individualized according to your chronic disease and to your personal health data status. So based on that, we make the recommendations for lifestyle interventions, helping him in his data management. It's simply stupid, and this is highly important because the people needs to use it easy. They don't need to think or spend a lot of time. It's very important for the compliance. And then we upload also the diagnostic examinations so that the physician in the end has a clear overview of how the patient lives his life. This will lead the doctor to prescribe properly and to reduce even the amount of medication, because as you know, just to increase the medication doesn't provide any solution.
So it's interesting you say that, and I'm going to jump over to you in a moment here, Dr. Lisa. Tim, I've known you the longest. You and I have known each other for 15 years. Prior to being a really cool moderator, I was the chief strategy and marketing officer of a company in the United States, a health insurance carrier. And one of the challenges I had with my own base of customers was that it's the old, like, everybody wants to go to heaven, no one wants to die, is that as we create these disruptive technologies, there needs to be early adopters. The early adopters have to be either at the government level or they have to be at the company level. Do they not, Tim?
Yeah, everything that you're talking about is the area that we're going, and you're right, it has to be easy. Wearables. We are such a society of, I want a quick fix, and if I can see the results today. They used to have these wellness programs that, the gym and all that, but there was no way to track it. There was no way. What he's talking about is exactly where we're going with the technology. I want to know today, what did I eat, what triggers, all of those things that I can look at today and make an impact on. I can change what I eat, I can change what I do. I'm not sure if I'm answering your question because I was so excited about what he was talking about. But that is absolutely where this is.
Because you can jump all over the place. That's like ADHD brains. We come back around. Yeah. We can do it. But early adopters. I mean, you have one of the most innovative technology platforms out there solving problems.
Oh, the early adopters. So I'm of the opinion most of the time I have to force somebody to do the right thing. That's not a good answer most of the time, but I force people to take when I manage their health or if I manage their insurance, I make them do the right thing. Once they do it for a while, it becomes habit. They're doing the right thing now. I have the right plan. I'm taking the right medication. I'm doing these things. Most of those people don't do it. Our federal government, when we're talking about technology, they're the worst. Their systems are so antiquated, all of that. And they're not early adopters of anything. To try to get that ship to move is impossible. They need to get rid of some of that and allow the private industry to do it because they do it so much better.
So some of the technologies out there right now may be a little unaffordable, Dr. Lisa. And for those that are in developing nations, I just came back from Nigeria, leading an event there as the Master of Ceremony and moderator for the Global Entrepreneurship Festival. There are people there that, there was a gentleman, I won't forget, I went up to go buy a coffee. And the guy said, no, I'll buy your coffee, I'll buy your coffee. I said, no, I can buy my own coffee. He said, no, let me buy you a coffee. And the coffee was $2. Well, what I didn't know is that required him to work about 5 hours in whatever his field is to buy my coffee. So when we think it's no big deal to buy a skin cream for $100 or $300 or some treatment for $1,000 or a premium or a medical, Dr. Lisa, how can we become more, they say that when you lack resources. I was a foster kid in my earliest days. I didn't come from privilege. I had to become resourceful. How can we become more resourceful, Dr. Lisa? Does it start with a mindset? Does it start with a moment, an aha? Where does it start?
Well, I think it first starts with education. We need to talk about what are the 5 pillars of longevity. Movement is medicine, bottom line. Mobility is longevity. When I educate my patients and around the globe, we need to talk about what are the 5 pillars. Number 1, sleep. We can track sleep. There are wearables to track sleep. And everyone, once you have this data, then you will make a change. Number 2, exercise. There's wearables for exercise. All of these monitors, heart rate monitors, and you can log in right on your iPhone. Exercise is number 2 for longevity. Number 3, nutrition. Just said, let's track what we eat. There's so many apps out there. How many calories did I take? Calories in versus calories out. Number 3 for longevity. Number 4 is flexibility. Because honestly, mobility is longevity. The more flexible you are, the longer you live.
But do I need a gym for this? Do I need a $20 a month membership? Do I need to sacrifice a chicken, shave my head? Like, what goes into this?
Absolutely not. You can do, as we were talking today, we are standing outside in the cold with 2 little bands, $5 each, and doing an entire workout. You don't need a gym. You don't need a lot of equipment. You don't need a membership. It's education. I promote a workout in a hotel. 3-4 things, very inexpensive. You get a full body workout. Walking the beach, swimming, that's what it is. You don't need this expense. So I think we need to educate the public globally that no, it's not, this is what it is, it's a mountain. No, you're just walking the beach. That's your exercise. And the last thing is mindfulness. That was a big predictor. Longevity, loneliness, mindfulness, meditation. It was one of the number 1 predictors in TED-Med for longevity. There's the large TED-Med talk about, during COVID, why did we have that? People were lonely. So I think you don't need this expense. It absolutely is out there. It's educating. I promote a workout. We call it the, weekend warrior workout. It's literally a travel bag, 5 things in there, less than $20, done and done, your workout's done.
Tim, I see you like, yes, I'm in. I agree. I'm in.
Yeah, it doesn't cost a lot. Just walking. I will tell you that I've spent a lot of time here in Switzerland lately. Everybody's walking. They're riding their bikes, and I'm cursing at them all the time because they're always on the road. They're everywhere. But that doesn't cost a lot to have a bike just to go for a walk and do all of that. Yeah.
Sounds like you're saying it's simpler than we give it. Like, it really is.
It's much simpler than we give. Yes.
So I had this incredible opportunity of interviewing somebody a couple days ago, and I had asked him this definition of success. So on behalf of Forbes, I've interviewed some of the world's most famous humans, people that you've heard of, people that you haven't heard of, and I like to ask them, each of them, like, how do you define it? I had this interview recently where I asked somebody, definition of success, and they said, well, doing the things I want to do. And then I had a conversation here at the Davos Lodge. It's the definition of success, and the definition was my health. If I can just be healthy. It's something that seems so simple, yet we don't pay attention to it until it's too late. It puts people in the grave early. Does anybody here know someone that died of some ailment that they probably shouldn't have died from? I mean, candidly. Had they spent just a little bit more time, had they have not paid for Netflix, and had they have paid for a medical procedure or some sort of medical device, or had they have, instead of using their TikTok on their phone, had some sort of wearable and tracked it to realize what matters. So talk about your side. Is this common sense, and do we spend enough time on this?
In order to be practical to whatever we are all discussing today, I would say that we need to be more organized as societies to succeed something like that. And I highly agree, of course, with Tim that we need to have private sector organize the whole thing, make a business out of it, because it needs to be sustainable as well, but to be efficient and cost efficient for the individuals as well. And then we need a system. And this is the direction we are heading on with the Hypertension Diabetes Corner, but of course this needs to be expanded also to other diseases. It's not only the cardiovascular disease, regardless if it is #1 cause of death and #1 cost of the public and private health insurance companies. But nevertheless, system needs to be there in order to guide the people. And it needs to be mass to all the consumers, to all the people out there. If it's not systematic, then a clinical coach has his own style of trying to educate people, right? And trying to help them prevent their chronic disease or to fight their illness. And someone else has another approach. And the people are confused. And you see so many theories in the TikTok, and I'm calling them theories because if you will see them, it's completely contradictory to each other. One is suggesting carnivore diet, another is saying never eat meat. So people doesn't know what the hell to do in order to maintain and improve their health. So we need to be systematic, and we need to have something that will be officially, how can I say, approved, officially approved from WHO or the health plans or the health insurance companies, that the clinical coaches will take place and the physicians will take their own place. And this is proven through tons of studies that you need to have human interface and software interface. Otherwise, you can never change the lifestyle of people. Because I believe you all have experienced it. If you have digital recommendations, you don't follow them. If I will send you an email and tell you exactly what to do next day or for the rest of your years in this planet, you will not follow it because it's highly tempting. Yesterday I had duck with fried potatoes. I don't eat fried ever, but yesterday the fried potatoes was so tasty that I made, it was an exception, exactly. But the point is, who has the discipline to behave properly all the time and to track all that? So to succeed something like that, there needs to be a system and clinical coaches in place, and it needs to be, again, something officially and globally approved in order for the people to give the necessary trust, believe in it, and follow it.
Now we have about 3 minutes left in the segment. I'm very curious, what book are you reading today?
Well, I just want to answer one question about success. I was hired by a patient at age 65, and he said to me, "You want to know what success is? You keep me alive until I'm 95. That's what he said. So he hired me, and for 30 years, I kept that man alive with my clinical approach to the 5 pillars of longevity, and he's still alive at 95. So that's the definition of success. You just said it, health, longevity. There's no price to pay for that. There absolutely is no price to pay for that. So I think that's really important, thinking about how do we move forward globally by creating this process through the private sector.
Well, if you could hold that thought till afterwards.
I just wanted to say, what book am I reading?
So
sorry.
Can add a question.
The book I'm reading, and the book I've read several times is...
By the way, this is where I listen when wise women or wise men tell me what they're learning.
The Brain That Changes Itself by Dodge. The brain changes itself. I focus on neuroplasticity. The brain can change. I have people with massive strokes, spinal cord injuries, unable to walk, shot in the line of duty, can never walk again. They come to my clinic, they walk. because neuroplasticity is real. The brain can change, it can adapt, we can grow new neural networks, and that's what we need to continue to tell people. It does work.
Final minute, Tim Johnson. Which CEO are you learning from today?
You know, I don't want to be the guy who mentions the name that everybody always says, but I like Elon. I like his attitude. I like the way he's so creative with everything. I like the way he manages his people. He's not, he has the ideas, he's learning, he brings the smart people in that know these specific roles, and they all manage it. That's what I like doing. I do not like to be in the trenches. I like smart people to do their job, and so I try to learn from him.
So we are out of time now for this panel. I know you're going to stay up with me. We're going to have a conversation on Your Health Matters. We have room for one more question as long as it's appropriate. Sometimes.
I didn't hear that name of the CEO.
Elon Musk.
Oh, Elon Musk.
Yeah.
Elon Musk. So the book is The Brain Changes Itself. I wrote it down myself. I'm going to get that book. So I learned that from Dr. Lisa today. And Elon Musk, I've heard of him before. He's kind of a big deal. Thank you so much. Let's give our panel a round of applause.